Hi guys, I'm Dr. Yumnasad and today I'm back with another video with the pediatric cough cluster. It is a very important cause and a very favorite topic for AMC clinicals, that is pertussis or whooping cough. So let's begin. First of all, let us have a look of what a whooping cough is. I hope all of you must know that what exactly it is. So just to give you a basic knowledge that it's basically a contagious disease that is caused by it's basically I'm giving you the information that you should give to the parents. So if you are having a scenario in which you have to educate the parents, you should tell them in simple layman terms, like it's a contagious disease that is caused by a bug called body telepertussis. Up to you if you tell the name or not. And basically it infects the smaller airways in the lungs that causes production of increased amount of thick mucus that causes clogging of those small air passages and making it difficult to breathe. The spread is by airborne. It's an airborne infection, so it can spread through airborne droplets or through close direct contact with the infected person. In Australia, it is less common because it is included in the childhood immunization schedule, but even with fully vaccinated children, they can get pertussis, but in those children, the severity of disease will be less as compared to those who are unimmunized or partially immunized. So in Australia, the usual recommended dose for pertussis is at the age of 2 months, 4 months, 6 months, 18 months of age, at 4 years of age, and at the year 7 of school. So usually we cannot usually you do not see so many cases of pertussis here in Australia. Okay, so for you I've made a case. I cannot say that it will come in exactly the similar way, but definitely the presentation will be quite similar to this one. The age group can vary, but presentation will be quite similar. So your next patient in a general practice setting is a 3-year-old girl who is brought in by her parents because of a history of 1 week of runny nose and dry cough, which got worse last night with sort of spasms of cough, which made them worried. So here your tasks are to take further history, any investigations you want to do, to reach a diagnosis, give your differential diagnosis, and management. Well, it does not necessarily mean that all 4 tasks will come together. It's just to give you an idea of and that these are the different tasks that can come, but they can give you in different ways. They can give you all 4 altogether or 1 or 2 of them. So starting with the history, as you can see in this stem, there are 2 important things that the child is having, that is runny nose and cough, dry cough. So just when you meet the parent, so I would recommend you that to make a general approach, whenever you start any station, just just greet the patient, know their name, that how may I address you, and then ask them how can I help you. Now in this case, you can start like this, that hello Mr. or Mr. and Mrs. whatever the name of the parent is. Uh, how can I help you today? From the notes I read that John, whatever the name of the baby child is, that she's having some cough and runny nose. Can you tell a bit more about her? How is she doing at the moment? In these type of cases like cough clusters, if there is an acute case, like if there's any problem with the breathing, or if the child does not look very stable to you, so the first question should be about hemodynamic stability. But here in this case, the child is having cough for about 1 week, and she was having some spasms of cough which made them worried last night, and they have brought the girl to your general practice in the morning. So it means it's not a very acute case, or it's so you can assume that the child is hemodynamically stable. Nowadays, AMC is conducting exams online where you won't be able to see the examiner, and the examiner's audio and video will be turned off. So you cannot ask about the hemodynamic stability. If the child is not stable, they are going to mention you in the stem. So there's no chance that you are going to ask. So you cannot ask from the patient that if is your child stable or not. So definitely you need to be prepared about this, at how to approach the case. So here in this case, let's start from the symptoms. So you ask the parents that I read from the notes that she's having runny nose and cough. Can you tell me a bit more about it? Then they'll start giving you the history. By this approach, if you ask the parents or the patient that can you tell me a bit more about what happened, they are going to give you much more information that you are going to extract from them. So first of all, starting from the history of cough, which I've already discussed in my previous video, just ask about how long they have already mentioned about one. So how did it start? Was it sudden or gradual in onset? How is the cough? Is it dry or is it productive? What is the pattern of cough? Is it throughout the day or any particular part of the day, more at night or more at some part of the day, or is it the same? Is the cough present every day or is there an including the weekends? Is it dry or usually the cough in children it's dry because they are not able to bring a large amount of sputum. So but if there's productive cough, then it means there's some infective reason. So ask them. So if there is if there's productive cough, then you need to ask in detail about the sputum, that what is the color, the consistency, odor, volume, and all that. I've already discussed in my previous videos. You can always refer to my the video of pediatric cough cluster, in which I've told you in detail about the questions that you need to cover in case of any cough scenario. And next you can ask about general questions. Okay, so you have the child is having cough and runny nose, so it all started like a common cold. So ask is if anybody else is having the similar symptoms at home. Okay, if the child is attending a daycare or childcare, she's 4, so ask about that. And then ask about how is her breathing. Have you noticed any once you have finished all the questions of the cough, I'm not going to discuss in detail. Uh, so you need to ask all the relevant questions of the cough, and after that move on to the breathing. Have you noticed any abnormality in her breathing? Is there any time the child is, you have noticed that she has pauses in breathing? And in the case of whooping cough, the pattern of cough is very important. Ask them about how is the pattern of cough? Is it like cough, 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 and then vomit? But usually in smaller children, they do not present in a typical whooping manner, and all they can present is a non-specific persistent cough. That's the only symptom, and there's no other symptom. So it depends on the age group. So if it's an older child, he can present with a cough, 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 and vomit pattern. But in younger children, they can present in a very non-specific way with just a persistent cough, or infants can even show pauses in breathing, or what we call as apnea, or a slight bluish tinge or cyanosis with coughing spasms. So you need to ask about, have you noticed any color changes in the skin when the baby is coughing? And always rule out any foreign body. Is the child is the child supervised at all times? Is there any chance of inhalation of a foreign body? Have you okay? And have you noticed any abnormal sounds while breathing? So these are the some important questions that you need to cover. Again, there's mnemonic binds. So the important point in binds here is immunization. Ask about if the child is fully vaccinated. So here the child is, I guess, 4 years of age. So he should be she should be vaccinated by now. So ask about the immunization status. Ask about any contact, as I told you, like if the child goes to any child daycare, school, or if she's in contact with anyone having similar symptoms. Any contact with pregnant women. Now, if you're assuming that she's having pertussis, then you need to rule out that if the child is in contact with some vulnerable people like pregnant women, a worker in a maternity hospital on a newborn unit, a childcare worker, or anyone whose immunity is compromised, because you need to take special precautions and you need to give them antibiotic prophylactic treatment. Okay. And nowadays, because of the COVID-19 pandemic, whenever anyone, even a child or an adult, presents with a cough, sore throat, runny nose, and these are symptoms, we do need to take a swab for the COVID-19. So because of this pandemic and COVID-19, don't forget to rule out the COVID before guessing other things. He can be definitely, these things are common. They can occur, like you are suspecting pertussis, but your job is to rule out COVID as well. Okay, so here's a list of people that they are of community people who are more vulnerable to get pertussis, and they are pregnant women. That's why pregnant women should be given a dose of a booster of pertussis vaccine during the pregnancy. It is recommended that if babies, especially children younger than 6 months of age, close contact to a known case, someone with a weakened immune response, or like maybe a cancer patient on chemotherapy, and those elderly whose immunity is waning. Now moving on to the physical examination. As I told you that here, because the clinical presentation varies according to the age group, sometimes there are no clinical signs. All you can get is a positive history. And you need to diagnose it on the basis of history, and there are no physical examination findings. But in case you should ask about what you are looking for is basically the vitals. In respiratory system, you all know the inspection, palpation, percussion, and auscultation, whatever we are looking for. Basically the subcostal intercostal recessions, any muscle usage of the accessory muscles, any nasal flaring or grunting, and palpation, the chest movements to chest expansion, and percussion, you need to know the percussion note, and in auscultation, the normal breath sounds and any added sounds like wheeze or ronchi or crackles. Next, you need to check the cardiovascular system and the ENT. But again, because of the online AMC clinical exam, all the physical examination findings will be given to you, and there's no need to ask one by one. So that's an added benefit of an online examination. Investigations in case of pertussis, they are not necessary. Usually GPs, they do not do an investigation, but PCR is a good diagnostic test. So nasopharyngeal aspirate or swab for PCR is the investigation of choice if there is some diagnostic uncertainty, but it can also be diagnosed clinically. So it depends. So if you say PCR, it won't be wrong. If you say I'm going to diagnose it clinically, if you are very sure, it's also the right approach. Now moving on to the management. How are you going to manage? It's a as I told you in the beginning, it's a bacterial infection, so we are going to manage it with antibiotics. But there is some important point. Antibiotics are given if the cough is present for less than 14 to 21 days, that is less than 2 to 3 weeks. If the cough is present, then you need to give macrolides for 7 days. If the cough is present for more than 21 days, then the patient is not infectious anymore and there is no need. Because in pertussis, it's also known as a 100-day cough. The cough will persist for many days. Even if the person is not infected, the cough is persistent for many days. And even if you give antibiotics, the cough will not go away immediately. So it may persist for a few days to even weeks. So the course of antibiotics is 7 days. Macrolides and then are the antibiotics of choice, and they should be given within 14 to 21 days from the start of cough. There are some important points in management that AMC wants to listen from you. It is that prophylaxis should be given. That is the same antibiotic should be given for 7 days to all the close contacts, any pregnant women in contact, any immunocompromised person, or anyone in close contact who works in a maternity unit or a newborn unit or is a childcare worker, uh, or anyone who is immunocompromised. So you need to give prophylaxis to them. The next important point is it's a notifiable disease. You need to inform the Department of Health Services, and it is one of the points that AMC is going to listen from. They really want to listen from you, and it's going to mark you up. So never ever forget to tell the patients, the parents, that it is a notifiable disease and it is my duty to notify the Department of Health Services just to maintain a record. And now comes a very important point, that is a school exclusion. Because it's a transmissible, it's a communicable disease, the child needs to be excluded from school or daycare, whatever the setting is. And there are two scenarios. If the child is not taking an antibiotic, then he should be excluded for at least 21 days from the start of cough. If no antibiotics are given, or if the antibiotics are given, then it's basically 5 days from the start of antibiotics. So any one of them, if the child is taking antibiotics, as I told you, 5 days from the start of antibiotics, and if not, then 21 days after the start of cough. Until this period, the child is not able to attend the daycare, childcare, or school. That's the school. So basically, candidates, they are very confused in this pertussis, and they think that there are so many things that we need to cover, and how are we going to cover that in that's 8 minutes. Try to practice it again and again. And as I told you, it's not necessary that all 4 tasks will come together. They can give you just 2 tasks, but then you have to perform much more better in both of those tasks. So if they are giving you 4 tasks, it means that they are expecting you a very minimum amount of information for each of the tasks. So try to practice it within the given time, that is the 8-minute time, how you are going to deliver. There's no need to ask any additional information. There's no need to ask about social issues and all this and that, because there are so many questions to cover about cough. You need to ask about any problems with the breathing, and you need to ask about immunization. Then you need to here in this scenario, because we need to take the history, the investigations, the diagnosis, and management. There are 4 tasks. So definitely, and once we are telling the management, we need to tell all these important points. So we should be very precise, and at the same time, do not try to be, do not go very fast. Check the patients and the parents' understanding, and make them feel comfortable, and tell them that it's preventive. It's somebody may ask you, what my child is even immunized with pertussis, why do they get that? So you need to tell them that even children who are fully immunized with pertussis can get the disease, but in those the severity is less. Maybe that's the reason that he is not having that severe disease as compared to those who are not immunized or are partially immunized. So it's good if he's already immunized, that's good. But even with those children, they can get the disease. And don't worry, so I'm going to give you antibiotics. They are going to help, and tell them that the symptoms may not go away immediately, but it is going to give them some relief. And besides the antibiotics, we are going to give you some supportive treatment, and tell about the notification, the child clear exclusion, and all those important points, and prophylaxis of the close contacts as well. I wish you all the best, and I'll be back again with another video covering the pediatric cough cluster. Meanwhile, if you have any queries regarding this video or my previous videos, just leave a comment and I'll try to respond to you. Thank you and have a good day.